Next up, we have Karen Hinshaw, who is the Program Manager for Community Health Partnerships for the Indiana CTSI. Karen has been with the CTSI in a couple of different capacities, right? So she's been with it for a bit, and she's going to talk to us about the really, really important piece of how we get our community partners engaged with us, how we engage with them, how we make sure that we're ensuring, help me with the phrase, I think I always maybe botch it a little bit, but nothing to us without us, right? And so we want to make sure that our community partners have a say in what happens. Read this. Thanks.
All right, hi everyone. How are you doing? I have important questions for you. Raise your hand if you like Halloween movies. What about candy corn? Do you like candy corn? Oh, wow, there's a lot of you. I don't like candy corn. Raise your hand if you have worked with community engaged research on some level, any level. And keep your hand up if you've worked with one of the community health partnerships programs that you know of. Okay, good. I want to see more hands next year, right? Like maybe not at the end of this, maybe at the end of this. Maybe you don't even realize that you have worked with one of the community health partnerships programs. So thank you for having me today and allowing me to share more about what we have to offer. And thank you to our Notre Dame colleagues for hosting and planning a great event. Really appreciate it. It's a pleasure to be here. So, oh boy, okay. I'm adjusting to bifocals and they don't work with the computer. So with community health partnerships, you may hear CHeP. That's our contribution to alphabet soup with all the acronyms. So that's us if you hear CHeP. I'll try not to say it because I'm trying really hard to say the whole phrase. So do you like to be told what to do? Because I'm not really a big fan of being told what to do. I love guidance. I love ideas. I love brainstorming, but I don't really like dictating. And so that's one of the main things that we stand behind with community health partnerships. We not only want to ask people for their insight, but we want to listen. We ask a lot of questions and we listen a lot. And we take all of that in and we think about it and we ask more questions. And then we ask more questions and try to figure out how we can help each other. So it's not about community health partnerships helping the community. It's not about the community helping us. It's really bi-directional. So we really want to help each other. And we do that by listening and learning from our partners out across the state. So how are we asking the community? Some of the ways that we're asking for community voice and community input include our Trailblazer fundings, where there are co-led research projects happening with university partner and a community-based partner. We have human-centered design researchers who are very creative in working with patients and caregivers to co-design, again, health solutions. We do have statewide health coalitions, and so we have coalition members across the state who have lots of expertise and resources, so they're sharing with us when we're asking for their input and assistance. We have advisory committees and boards from across the state with community-based organization representation and university representation. And then we always want to partner with people to learn how we can continue to be more inclusive and grow in those areas. This is the first program I'm going to talk about within community health partnerships. It's the one I'm most familiar with because this is where I came from. So this program started back technically in 2018, really didn't get off the ground until 2019, when 3 statewide health coalitions focused on different areas of chronic disease came to Indiana CTSI funded by the Indiana Department of Health, and they created Connections in Health. That's where it came from. Since then, we have several other partners. You can see in the fourth quadrant on the slide, some of them are funded, some of them are just intentional partnerships to make sure that we're working together and collaborating. So because I know that text is small, I want to tell you those coalition names: Hoosier Health and Wellness Alliance, Cardiovascular and Diabetes Coalition of Indiana, and the Indiana Joint Asthma Coalition. In case you've heard those are part of CTSI. So when the project first started, we were trying to figure out how do we get to know people across Indiana, and how do we get that community voice, and how do we let them know we're here if they would like to work with us, or if they are looking for some resources. So 10 counties were selected from a lot of data that went into play, and then talking with our partners, our funders, and finding out where are the priorities, where do you think we should engage. So these are the 10 counties. We started engaging with them in 2020. We're on the last county right now, which is Clay County. So we're still working there, working through the process there. And for us, engagement includes building a local county engagement team. So we want people who are in the community to advise us and tell us, this is how you talk to people. These are things that you stay away from. These are key people in the community. This is how you can get your message out. This is how you can reach people. They know your community where you live better than I would. So we did listening sessions in these counties, and then when we were finished listening to people, we put all the information together and shared it back in what we call data for doers. Here's what you said. Here's what you told us was really successful. Here's what you told us was concerning or challenging, things that you want to work on. Now, where do you want to go? So from there, we had some deeper conversations with some community leaders and community members. Our Cardiovascular and Diabetes Coalition provided $10,000 in community funding to each of the counties, and they decided how they wanted to use that funding to implement projects to positively impact prevention and or management of diabetes and cardiovascular disease. So we went through that whole process, and there were a few extra steps in a couple of the counties. So what can Connections in Health do for you, or how can we work together? We do have this model. So if there's a group or a community that you're trying to engage with and you want to hear from their perspective what they think needs to happen, or what they would like to work on, what they think would be a big challenge to assess and to work on together, we can help with that. We can help with assessing community readiness. That's that extra step that I mentioned a minute ago. We have gone through the community readiness assessment process with a couple of communities. Have you ever had a great idea and you thought, this is what this community needs? And there are some people in the community who are like, yeah, let's do it. Except that it's maybe not the person who has diabetes, or it's maybe not the person that's going to be directly impacted by it, and they don't even want to participate. So this community readiness assessment can help with assessing, is it going to work? Like, are people actually ready for this? And in both communities where we did this, they weren't. The communities weren't ready for it. So I'm really glad we did it, because we were able to take a step back and help those community partners figure out where they need to start and what the community was ready to try. We have, like I mentioned, we have these statewide coalitions, but we also helped build local coalitions in some communities where there weren't health coalitions. We have a whole website of resources for coalitions if they're existing and they would like to figure out how to be even stronger, or sustainability plans, things like that. We have lots of connections with community partners across the state. Our coalitions have members in every county in Indiana, so if you're looking to get connected somewhere, Connections in Health is probably a great place to get started. And then lots and lots of resources related to chronic disease and the areas that the coalitions focus on. This is another one of the programs within Community Health Partnerships. It's called Research Jam. Some of the most innovative, creative designers and people I have ever met. Really neat team that figures out how to pull information or gather information from people in very unique and creative and engaging ways. One of the examples I like to tell is, and I don't know what the topic was, I think they've used this several times, but think about your care for, I don't know, cancer. So we'll talk about survivorship with cancer. So instead of just directly asking a group of people, how did that go? How was that? What went well? What didn't go well? They might have them write a love letter. Write a love letter to your care team and tell your care team what you loved about everything that happened. And then on the flip side, let's write a breakup letter and tell them about the things that did not go well. And just by doing an activity like that just opens up so many possibilities for people to be able to share their experiences and what they have learned. The best time to connect with Research Jam is in the early stages of planning your proposal. They can help you with that. They can brainstorm with you. All of us love to talk to people. It's a very friendly group of people in community health partnerships, happy to do consultations and give you some budget estimates and help with that proposal development. There are lots of publications from Research Jam. I'm assuming you're going to get links to these slides afterwards, so you can click on that if you would like to see some of those publications. Oops, wrong button. Okay. I know, I'm making you drink from the fire hose, but there are so many great things happening within community health partnerships. So on to the next one. We have Trailblazer Pilot Awards. This one is up to $25,000 over 2 years, and this could be to evaluate a program that's going on or further develop a program that's going on. It is a community university partnership. So you would need to have a community partner, community organization. This, I know you can't read this. I know it's super tiny, but like I said, I think you'll get a link to this. The point is, these are people from Notre Dame that have been Trailblazer awardees. So since 2012, most years someone from Notre Dame has applied and been funded. So check this out when you can read it, because it's super tiny, and see if there's somebody on this list that you're familiar with or the project that you're familiar with that they worked on. And you could talk to them about their award and you know what they were able to accomplish. There's also a planning grant. This is a $5,000 planning grant to help you get started. It's kind of a jump start. I think it used to be called Fire Starter, in fact. So a chance for you and a community partner to get together and kind of plan what that project would look like, and with the hopes that you're going to be able to apply and be funded for the award in a future year. So for Trailblazer, we can help support your work with a planning grant. If you're just thinking about it and you just need some time and some funding to help get your heads together and some support. There are lots of opportunities, there's orientation, and there's lots of opportunities to get together with others, to share your work and to gain feedback. So think of it as a community that you're a part of. If you're not sure, just ask. We're happy to have conversations. You can, Sarah, myself, you can email any of us and we'll end up getting you to the right person. So just ask if you have questions. Okay, on to the next one. WISE Indiana, and WISE stands for Well-Being Informed by Science and Evidence. And it's a partnership between Indiana CTSI and the Indiana Family and Social Services Administration, which is a huge mouthful. So typically you'll see FSSA for that, for the acronym for that organization. So you can see their areas of expertise there for WISE, aging, disability, early learning and childcare, health equity, Medicaid, mental health, and substance use. So WISE matches researchers who have expertise in certain areas to FSSA projects based on their expertise, experience, and their availability. So they may be working with on an evaluation plan. They may be working on implementation. It could be a data project. It could be project management, subject matter expertise, technical assistance. There's all kinds of different ways that they can help provide these services. Success stories. So for WISE Indiana, researchers worked with the Indiana Behavioral Health Commission, and eventually that research was used in support of Senate Bill 1, which ultimately down the road helped establish the 988 mental health crisis hotline. So to me, I think that's a huge success. People now have this crisis hotline that they can call when they're feeling like they're in crisis and they need some mental health help. So pretty neat that they were able to be at the very beginning of that. Here's a Notre Dame connection. There is a, actually, I think it's still ongoing. I don't think it's done yet. Okay, I got confirmation. This is still ongoing. There is a group, Division of Mental Health and Addiction, working to put together a retention and recruitment program for the behavioral health workforce. So they have a community of practice, and they're hoping to be able to come up with some best practices that can be used not only across the state, but outside of Indiana as well. So great Notre Dame connection there. So for WISE Indiana, the best thing that you can do is join our network, our Community Health Partnerships Network. It's called the CHeP network, lovingly. And that's one of the first places that the WISE team goes to find experts to work on the task order projects, because you are able to put in what your areas of expertise are and what you would like to offer when you join the network. So if you're interested in that, I think there's a link at the end of this that you can join if you haven't. Okay, next one, All In for Health. I told you we had so many. So All In for Health has one way to disseminate information. I didn't mention this about Connections in Health, but the coalitions are another great way to disseminate information. So if you're doing research, or if you've finished some research and you are ready to share that information out, we do have a lot of opportunities that you can use to disseminate information. One of those is the All-in-1 Minute e-newsletter. It comes out monthly. It's a quick read, packed full of resources. There's typically a topic for the month, so it might be National Diabetes Month for November. I don't know if it is, but it could be. And so then they'll have lots of information about diabetes and also opportunities to participate in research. So they have an online list of hundreds of studies happening in Indiana and a library of health resources available in Indiana and nationwide. So here is a little bit more information about All In, and you can see on the map the demographic or the geographic location, and then there's more demographic information, which is probably too tiny for you to see now, but you can look at it later, I promise. So they have over 14,000 volunteers across the state, and this registry helps researchers meet enrollment targets and recruitment targets for their studies. So All In for Health is a way for you to partner with the public and talk directly with the public, share volunteer opportunities with the public, and also, like I said, disseminate information when you're ready to do that. This one I'm not going to talk a lot about because you heard about Impress earlier. What I want to impress upon you, though, I didn't practice that just happened, is that Community Health Partnerships has that community engaged opportunity for you. So if you do community engaged research and you would like to host a medical student for a summer project, let us know, because we would be happy to see if we can find a match. These are pictures, I think these are all students from this past summer that were involved with Community Health Partnership. And here is another Notre Dame connection. So Dr. Heidi Beidinger had Susie Kim working with her this past summer, looking at semi-structured Zoom interviews related to the lead work that she's doing. And that's Susie with her poster. By the way, I don't know if this was said earlier, but the students have, it's kind of competitive. They have an opportunity for, it's a financial incentive if they kind of win this poster competition. So really good experience for them to get their feet wet with research, and then also building a poster and trying to do the best that they can do and get that extra financial incentive. You made it to the end. Okay, I'm turning off the fire hose. This is the QR code if you do want to join the Community Health Partnerships network. We call it the CHeP network. So if you do scan that code and it pops up, it'll say CHeP. You're not signing up for anything that you won't regret, I promise, or that you will regret, I'm sorry. I don't think you'll regret it. Anyway, you'll get a newsletter typically. It's usually very helpful and informative, upcoming events, different updates about the projects and programs that I talked about. Depending on which other programs that you want to be a part of, you may get additional newsletter like the All-In 1 Minute newsletter or the Connections in Health newsletter. Check all of the things that you think you might be interested in, because we are always looking to reach out to people and ask, hey, you checked this box that you have expertise in this area, or you're interested in this, here's an opportunity for you. You can always say no. You can always say, I'm a little busy right now. There's no commitment by joining the network, but it does kind of keep you in the know a little bit more about what's happening and what's available. Any questions?
Thank you, great talk. I had the wonderful opportunity to work with a med student during his time with the Impress organization this summer, and I was wondering, it might not be applicable to undergraduates, but I mentor a lot of students who are pre-med with compassionate care and poverty study minors. Is there any way to plug, maybe volunteer, if it's not directly research, opportunities with your organizations for them? I think they'd be very interested at Notre Dame.
Yeah, so we would welcome students to shadow. We welcome them to join any of the statewide coalitions. If they do any work for us, we have to go through the HR process and pay them. But they can shadow if they would like to learn, and they can be members of any of the coalitions. And I can tell you that the statewide coalitions have speakers. They meet every other month, and they have speakers, and they are often related to social determinants of health, health equity. We just had a group that took the Hunger Banquet, that's a global program, and made it specific to Indiana. So there's a big passion within, especially the coalitions and the coalition members, to work with people of all socioeconomic statuses.
Even though they can't work with the CTSI, there's HR rules that they have to pay for that, but we can connect them to the organization that they can work for.
Great. Thanks, Karen, for that great overview. I just had I guess, two related questions. One of the things that struck me when you showed the communities or counties that are in Connections in Health that you're involved with, that a few are on top, more in the middle, and a few at the bottom. I'm wondering if you could, if there's any insight that you could share about what these different counties and the different parts of the state might have in common, as far as, you know, what they're willing to do versus what roadblocks they might have, because that seems to be an issue for, you know, that you mentioned. Is there anything you could share with us about that?
Sure. When we did the listening sessions and we put the data together and shared it back, it was really interesting to see that most counties had similar challenges, whether they were Stark County, clear up at the north, Jennings County, clear south, or Marion County, that's urban. Lots of things that were similar rose to the top. It was typically food insecurity, poverty, transportation, access to care. So a lot of the social determinants of health challenges. And it was pretty consistent. They didn't always rank, okay, this is number one, but usually the top 5 or 6 were very similar in most of the counties. I would say challenges beyond the health challenges that they talk to us about are very different between the counties. Stark County doesn't even have a Walmart in their county. Blackford County just lost their hospital, their critical access hospital last year. So it's very diverse as far as what they have, resources that they have, what they have healthcare access to, if they have transportation systems at all. Some don't have any type of transportation system. So those things varied quite a bit.
Yeah, that's good to know. I guess my second question comes from you mentioning, the things that All In for Health does. And I'm wondering if there's a synergy between Connection and Health and All In for Health. Whether they overlap or are they very distinct?
Well, interestingly, we have a regular meeting. I'm looking at Brenda because I can't remember how often it is. I don't think it's monthly, but All In for Health and Connections and Health teams are meeting regularly to talk about what are the topics, what's going on, what are we working on, how can we synergize and be collaborative. Anything you want to add there?
I think it's like once a month, but it's, so we're usually talking All In for Health with a bunch of other groups about what they're doing and making sure that we're coordinating and kind of working together. Any ways that, we can kind of include people, or if we need to have some more conversations with other groups, or how they can connect with All In for Health, we'd be happy to do that, as well as I'm sure with Karen and CHeP as well. So, and all of us. All not to be confused with All In for Health, all of us.
If there's a capital IN, it's CTSI
Indiana,
program.
and then you can think of us as US. That's how I tell people to remember it. So,
For all of us, yeah.
yes. Yeah, see, there you go. See, now everybody, that's one thing you learned today. Us, US, so. Did that answer your question, Joel? Yeah. Okay.
Other questions? Yeah.
Locally, we're talking about a regional community health needs assessment and also connecting our local resources to that. So again, we understand that each other are, again, how can we work together versus creating a bunch of different things that are not aligned? Any suggestions, recommendations, best practice on that? Combining with CHNAs.
Jess, I was going to say something a little bit different, but it's more for All In for Health, and then maybe Karen can kind of add. But for All In for Health, just to kind of give you a broader sense, when you saw the map, it really is, the goal is to engage. We have a community advisory board. It's really to engage the public in research. So if you're doing research, we would love to partner with you. You don't have to create your own registry, especially like we've been working to try to increase the number of participants throughout the state. So would love to kind of get people around South Bend and surrounding communities. And so if you're looking to kind of increase the number of people that are participating, especially diverse populations, let us work with you and we can kind of help increase that together. And so that way you don't have to have a separate because usually what happens with a registry is people create their own and then it's limited because people aren't eligible or whatever, and so then people go stagnant and then they fall out. So by having something that can be utilized from a larger group of people, that a number of people could be eligible for, it's not based on one specific disease or area of focus, then it allows people to be engaged in research across the entire state. And so something to kind of think about. Additionally, we have a lot of IU studies listed on the All In for Health because we are directly connected and I have access to the IRB. For Notre Dame, every once in a while we hear from a Notre Dame investigator who says, hey, we'd like to provide information and have our study on that listing. We would love to provide more Notre Dame research or projects, whether it's up in the South Bend area or somewhere else. And so all you have to do is reach out to us as the team and we can work with you to get that up on the website. So that's just one way that you can partner with the community and community partnerships, or if you want to talk to our CAB board members. These are people in the community, so these aren't just lay people. I mean, they are lay people. What I mean is they're not just people in community organizations that maybe don't represent the community, like when Karen was kind of explaining. So just something to think about. We'd be happy to work with you in that way, and I'm sure there's other ways to partner within CHeP as well.
And I'm not sure if Brenda introduced herself, but the person talking is Brenda Hudson, and she's the All In for Health program manager. Thank you, Brenda.
Jessica, that's such a great question about the CHNA coordination. Many of us have tried to do that in many different counties over the many years, and it's it is hard to do, but I'll just mention a couple of other ideas. One is, I think it would be really, really great to leverage the informatics resources that Titus highlighted more for CHNA assessments, depending on the county and the region, and we could look at that for St. Joe or, how that looks, but it's probably decent and a lot cheaper than like a primary data collection source if you're looking at particular health outcomes or, health equity indices. Some of those are already sort of done across the state at a county level, sometimes more granularly, depending on the data source and availability. But I'd be happy to talk more about that with you based on other conversations I've had with other counties. The other opportunity, I think, is in health coalition capacity building, and that's where I think, connecting in with Connections in Health and sort of the work that's been done in other counties is like a learning system or like a, learning from peer counties on what they're doing is like so incredibly valuable. So Connections in Health has a lot of those ties, right? And so if there are certain things that have been identified here locally and you're wanting to find, I think similar to what we're talking about earlier, other counties that are experiencing similar challenges and learning from them in terms of best practices. Sometimes it's that like firsthand knowledge and like partnership that will help you get over those hurdles and some creative ideas that may be specific to our local ecosystem here in Indiana, right? And then also access to best practices nationally. And through that, I think there's the CTSA network that is always an opportunity, right? So we could be querying through a variety of networks that we have access to. I'm thinking of there's a community engagement brokers group where folks like Karen, but across all 64 sites are gathering. So, this could be a discussion item that we could bring to that national group and brainstorm solutions depending on how much you want to do, as well as the equivalent group for community engagement directors. I sit at the national level in the lead team. So I think at a variety of levels, we could be thinking about this. I do think that there's so many inefficient, I could talk on and on. I'm sorry, I'm going to bring this to a close, but there's so many things that need to be done and increased coordination in this arena so that we're really getting at both the grassroots input, but also leveraging existing resources that we have from like data and engagement and other best practices. I think it would be ripe for even like thinking about this as perhaps a grant application that could perhaps partner with several other CTSA hubs to try and dig into this across a couple of states. So if you're interested in that, I'd be happy to talk more too.
So while the mic is traveling, as Sarah was talking, it made me think we also have lots of partners, and one main partner is Purdue Extension that has an office in every county in Indiana, and also does a lot of trainings related to coalition development as well.
So this probably isn't a question for Karen, it's probably more broadly, maybe Sarah. First of all, thank you, Melanie, for organizing such a great morning. I've definitely learned a lot. It's been a wonderful overview, especially how CTSI is expanding out into the community and making all of these partnerships. What I'm wondering is CTSI, either by itself or through its universities, lobbying at the state level for better health policy? If not, maybe that's an opportunity. If so, is there a way that CTSI members can be engaged?
I can tell, I'm looking to see if the powers that be want to address this. I think they do, but we actually have a meeting with the Connections in Health team and some of the governmental relationships team at IU tomorrow afternoon to talk a little bit more about what can be shared advocacy and policy-wise from the coalitions. Just because we're affiliated with IU, we want to make sure that we're staying within our boundaries.
I was just going to say that same thing. So I'm sure the same is true for Notre Dame and Purdue, but each institution has their own legislative agenda and their own legislative individuals, and typically they don't want us to step on those toes. But that doesn't mean that we can't increase and raise awareness of some of these issues. And part of it is that, in particular, the trust in science and what we can do to try to improve that. So I would absolutely, I'm a big advocacy fan. I would love to have like let's get everybody from the CTSI go to the State House and do something. But we've had our hands slapped a little bit, and I think we need to be conscious this particular budget generation year and the political climate that we don't shoot ourselves in the mouth at this point. But what can I say? Was that politically correct? Okay, thank you.
I would just add, we try and shape policy by science and evidence, right? And so I think there's a couple of fronts that we can really shape policy here, and one is having local data and local evidence to share with our state representatives. I could make some comments there, but I won't. But I do think that, doing stronger science here in Indiana using local data does make a difference. And then having those impact stories of like how that's translated, we're all about impact, right? So having those ready for those who seek to serve us, and represent us in either the state or, at the national level, I think is incredibly helpful. That's something that Sharon and I have seen repeatedly and is being emphasized by NCAT's leadership. A couple of other pieces, like, we mentioned WISE Indiana, and Karen showed how everything flows through sort of that central CHeP network sign up page, but and that's intentional because we don't want to give you like 50 different links for all the different programs, but it is tailored to your needs, or tailored to your interests. So you aren't going to be barraged by a bunch of, daily or weekly. I mean, mostly it's monthly or quarterly type interactions. But for the WISE network, if you check that box, we will get sort of the expertise of where we can plug you in, like Karen said. And I do think that it's through partnerships where we're really going to be making a difference, right? So I would encourage you, if you're able, and we're able to connect you in, for example, with an FSSA division to answer a question that's of value to them or that they need, that you consider saying yes, even if you don't have a lot of time, because that's the first step in demonstrating trustworthiness, that you can respond to a need of theirs. So going in their door and perhaps coming out hours, right? So by fostering that relationship and an open communication and dialogue with state government, I think will help in having them lean on us when they have a need for additional evidence and guidance. And then finally, we are a partnership, or we do partner with Purdue, who leads a Family Institute seminar with our state legislators every year. So they survey those interested in health topics in our state legislature, and they pick one topic that relates to families and wellness every year, and then they bring in guest speakers. And it's a really nice forum with our state legislators who want to attend to demonstrate best practices in other states and other evidence just more broadly. And I think that's another place where we can sort of drill in on a particular topic, again, of the state legislators choosing, but to start that dialogue and try and be there and responsive to their needs.
I just want to add to, we really would appreciate if people have like a cool thing that's happening, they interact with the CTSI in some way, whatever that way is, and it turned into something glorious. Please feel free to email us and
to send us notes. We're trying to figure out how to collect this from a lot of people. But impact stories take a long time to develop. And so we don't have the robust tracking that we do, but it tends to be more numerical, number of grants and publications and things. But when you're dealing with legislators, particularly at the national level with NCATs, they need to have like concrete stories that they can tell made a difference in that legislator's district. And there's no way that we can actually do that unless you all help us and get data to us. So it's really, really important to think long-term. And I know things that happened 10 years ago because I happen to know who that person was, and I see them do something and I go, oh, didn't you have a CTSI pilot fund? And they go, oh yeah, that was the first thing, it was instrumental. And that's the impact story, but I don't have a mechanism to track it, or we don't have a mechanism. So please, 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 when you have good things happen, let us know. Thanks.
Great discussion. Thank you so much. We do have a breakout session after lunch if you'd like to join that conversation.
Thanks, Karen. Jess, any questions online? Yeah, there's a comment. Okay.
So Emily Hardwick commented that through our work in WISE, W-I-S-E, we are able to make an impact on state-funded programs through the Indiana FSSA in our work on evidence-based research and evaluation of their programs and services helps to make an impact on the programmatic and sometimes also the policy level for programs offered through Indiana FSSA.
Great. Thanks, Emily, for that comment.